Camera on, you're ready. Time, are we okay on time? Okay, she's going to give you numbers every minute. Sound good? Go for it.
We're now in the 21st century where the medical and transportation is really developed. But accidents will still occur. Like during summertime, people may go to the river and they may accidentally drown, or some hikers, they may accidentally fall down from the mountain. All these things, all these accidents happen all year round. And whenever these things happen, what will you do? Will you panic and fall on your feet? Or will you call 119 and wait until the rescue to come? Or will you actually perform some emergency first aid to save that person? So we can picture this scenario. When your family members, your loved one, your friends, when they get into an accident, will you call the police and the hospital to come and help? But isn't it just too sad? Because what you can only do is to call and ask for help and watch them suffer while you wait for the rescue to come. So that's what I'm here for. If these things happen, I hope that we all can be ready and trained well to face these problems. So I'm going to teach you a way this way is really famous and a lot of people use them. And this is called a cardiopulmonary resuscitation, or the CPR. When people stop breathing but their heart is actually still pounding, you can perform this on them so that they may be safe. So the step is like this. First of all, when you see a victim that is hurt, you have to first look at the environment around. Is it safe or not? After that, you run to your victim, try to push them to see are they awake. Maybe you can call their name or whatever. But after that, if you check that they are not awake and they actually stop breathing, but their hearts are still pounding, you can first call the 119. And while you're waiting for the rescue to come, you can first begin with the chest compression. You need to first interlace your hand like this. You use your palm here. And it's better for you to put your dominant hand on top. And then you put it in the middle of the chest, which is around here. The middle, and you put your hand like that. Interlace it, and then you push it like that. You need to perform this in the rate of like 2 times per second, which is really fast. And you need to do this 30 times chest compression. After this, you can start doing your breath rescue. You can use a mask, which is better to use a mask. You put this on top of the victim's airway, and while you're doing this, you need to first tilt their head and lift their chin. And to check their airway, is there anything inside? Because maybe something may be stuck inside, so when you perform the breathing rescue, it won't really work out. So after that, you put your mask on top. You breathe in 3 big breaths, but while you're doing that, you need to pinch your nose, and then you need to breathe in. After you breathe in, you need to turn to the side and to look at the chest. Does it rise or not? You need to perform this 3 times, big enough for the chest to rise. After 3 times, we repeat the step of chest compression. Interlace your hand, place it in the middle of the chest, and you push down. Your hand has to be straight. The power comes from your body, not from your hands, so you push all your body down. Okay? After that, you need to make sure you push in around 2 inches, which is 4 to 5 centimeters, around this deep. You repeat the step of chest compression and then breathing. And for this CPR can be used for children around 3 to old people, but for babies that are smaller, you still do chest compression and breathing rescue, but your breathing rescue, you only need 2 breaths. And for your chest compression, it's only around 1.5 inch, which is around 3 centimeters. So if you don't feel comfortable doing the breathing rescue because you're not trained or what, you can just do the chest compression. It's also called the hand-only CPR. Remember, you need to do it 100 times per minute, and then the rate is 100 times per minute, and you need to do it 30 times. Make sure your hand interlaced and is in the middle of the chest. You need to push it deep enough that is 4 to 5 centimeters so that you can actually reach the heart. Repeat the step, and you can review this and practice this at home. And there's a good way for you to do this. You can go to the training center such as the Red Cross so that you can actually get trained and a certificate so that you may feel more comfortable while you're performing this. But this training is really fast. It only takes you like half a day to receive this. So when accident actually occurs, you can actually do something instead of just staring and watching them suffer.